Renowned disease detective Dr. Michael Osterholm has been at the forefront of countering some of the biggest global health threats, from COVID-19 and measles to SARS and swine flu. And now he has a fresh book with a fresh warning. The book is called The Big One: How We Must Prepare for Future Deadly Pandemics. Osterholm imagines a coronavirus-like virus emerging. This time, though, more deadly, more contagious. Yeah, Dr. Michael Osterholm joins us now. Doctor, thank you very much for being here.
Thank you.
Just saying, we've interviewed you on Zoom and stuff throughout the pandemic, never seen you in person, so welcome. This is a scary book because it imagines a very scary scenario in which a lot of people get sick and die. How likely is that scenario?
It's very likely. For example, one of the premises of this scenario is that the virus, which is a coronavirus like COVID was, actually is as infectious as SARS-CoV-2 or COVID was, which was highly infectious, but it didn't have the ability to kill like the Middle Eastern Respiratory Syndrome or MERS or SARS did. That was a virus that killed 15 to 35% of the people, but was not very infectious. This virus is a combination of the two, highly infectious and can kill. And we've actually now discovered these very viruses in bats in China in the caves just in the last 6 to 12 months. So the possibility of this happening is not some remote maybe. There's a real likelihood it could happen.
Did we kill the bats?
The bats, ironically, carry a number of infectious diseases that don't kill them. Everything from rabies to you name it. So that's not a good indication. The indication is when the people start dying.
But when we find so it hasn't made the jump.
It hasn't made the jump yet. It hasn't made the jump yet.
Okay.
But today, in this world of 8 billion people interacting so closely together on planes flying around the world, taking down jungles, all these kinds of things, the interaction is so high that it really gives the virus an advantage.
You know, you talk about the lessons that we've learned from COVID. And looking back on it, there's things that we can even look back on and second guess now, like wiping down groceries. You mentioned the hygiene theater, the plexiglass, or the 6-foot rule. Why were we so focused on the wrong things during COVID?
Were all of those wrong?
Well, they were wrong in the sense that there was enough understanding to say, for example, this is an airborne disease.
Right.
Airborne disease means 6 feet was irrelevant. It was about how the virus carried in the air. Imagine walking down the street today in New York City and you smell cigarette smoke. And you realize the person's 35, 40 feet in front of you, but upwind. That's an aerosol. That's how this virus was moving. And we needed to give people that information to say you have to wear a special kind of mask.
Yeah.
The one that we call an N95. How many people wore chin diapers? How many people wore surgical masks that provided little protection?
Or wore nothing at all.
Or nothing at all. And that was the best tool we had at the time, but people, unfortunately, in our public health community, couldn't get together to understand that. And just to summarize it, the chief scientist at the World Health Organization, who in 2 years into the pandemic resigned and left, and her departing interview, she said the biggest mistake we made was not getting it right on the air with what happened with COVID.
So what needs fixing the most to prepare us for what you call the big one?
Well, when I wrote this book with my co-author, Mark Osterholm, I had no idea we'd be in the place we are today in this country. We're in free fall. Basically,
what do you mean by that?
At this point, we have a public health system that's being destroyed overnight. And it's one that, rather than believing in science and all that it's accomplished over the last hundreds of years, we're now talking about magic, smoke, and mirrors. And the inability to deal with things now also impacts our ability to plan for the future. For example, the vaccines that we need for future pandemics were just basically taken off the shelf by this administration and said we're not going to fund the mRNA vaccine technology anymore. Things that have no basis in terms of science, at least. And so I'm very worried that we're not prepared for today, let alone for tomorrow.
But this administration says we're streamlining functions, that we're saving taxpayers' money. Do you believe that there's any merit to some of the changes?
We always need to be, looking at change and how to get better and how to improve. I mean, that's something all of us, even here right in the studio. But the bottom line message is from a science standpoint, we know a lot of what we need to do.
Yeah.
And we're not doing it. And at this point, we are gutting public health as we know it. The CDC, think of that as your ring cam for health. It's everybody's, every day, organization that's watching for your health. That's being destroyed. And so I have a hard time getting into the place of where are we with preparing for the pandemic, which people have to understand is going to happen. We can't even get it prepared for the COVID vaccines for this fall.
Wow.
And so we have a huge challenge on our hands right now. And this book offers the solutions for what we could do long term. I do believe there's a day when we could take pandemics off the table.
Well, I hope people in positions of power read the book, and I hope those bats in the caves where they have the thing you're talking about, I hope no one pokes them and gets what you're talking about. Dr. Michael Osterholm, good to see you in person. Thank you for being here. The book is The Big One. It'll be on a big display in your local bookstore. Welcome back to CBS Mornings Plus. More than 5 years after the start of the COVID pandemic, one of the nation's leading disease experts is issuing a new and urgent warning. The next crisis could be worse. In his new book, The Big One, How We Must Prepare for Future Deadly Pandemics, Dr. Michael Osterholm imagines the impact of a virus 7 times as deadly as COVID-19. Dr. Osterholm joins us along with CBS News medical contributor Dr. Celine Gounder, who served on President Biden's COVID-19 advisory board, is also editor-at-large for public health at KFF Health News. Glad to have you both here. You're coming back. You were here in the 8 o'clock hour as well. And you're going to have some questions. You're going to help us ask better questions here. But first, the likelihood of a terrible pandemic, Dr. Osterholm. You say it's very likely. Really? Very?
Well, the pandemic clock is ticking. We know that there'll be additional pandemics, and some might be milder than COVID, some may be the same, but clearly the potential for some to be much worse than COVID is very real, and we have to prepare for that.
So you would think this is game 2 of the season. We just had one 5 minutes ago. Does that not make us more ready, not less?
We are much less ready today, and for the following reason. One, we are completely ignoring the lessons that could have and should have been learned from the past pandemic. And that's what we kind of concentrate on in this book, is saying we needed a 9/11-like commission following the pandemic to say what went right, what went wrong, how could we make it better, what do we need to prevent a future pandemic from taking over the world? And we haven't done that. And really this book was an attempt to just be honest, unvarnished. This is what we learned, we should have learned, we didn't learn, what are we going to do about it?
Dr. Gounder, I'll let you jump in because I know you have some questions too.
Yeah, so Mike, we know that public health is our frontline defense against the next big one. We're seeing this massive meltdown now at the CDC. The director has been fired, multiple leaders have resigned. There's a real crisis of confidence also in the CDC. With critics like Secretary Kennedy saying the CDC has lost credibility, how do you think the agency can realistically win back the public's trust?
First of all, we have to recognize we're in free fall. I've never known a time in my 50 years in public health like this, where is the leadership that can take on the mis and disinformation? Right now we have 2 forces out there working against each other. One is science that has brought us all the benefits of increased life expectancy because of reductions of illness over the last 50 years. And then we have magic, smoke and mirrors. And those 2 are in competition right now. And what Mr. Kennedy represents is the magic, smoke and mirrors. And that is misinformation that is making the public think that he's helping when in fact he is actually causing great harm. And not just for now, but as we talk about the pandemic preparedness. As you so well know, one of the most important things we need are better vaccines for these future pandemics. He ceased all the funding for this critical initiative to do that. So it is an issue. I don't know what it's going to take to change this dynamic, but I can tell you the world has to understand, and specifically the U.S., this is about literally science versus magic.
Now, there is, to your point, there's a growing concern that science is taking a backseat to politics, and some people actually think science is an ideology itself. What needs to happen for people to understand the scientific process and for that scientific process to remain politically independent?
Well, first of all, let me make it very clear. The public will understand the impact of this because we're going to see more disease. We're going to see more people dying needlessly. We're going to see outbreaks that don't get detected early because we don't have a public health system in place. We're going to see vaccines that have saved so many lives for so many decades suddenly not available. That will begin to play quickly in the public. They'll see that. It's going to be a direct impact issue. I hope it doesn't take that to get to this point where we understand the importance of science. The fact that science, by the way, is not truth. Science is the pursuit of truth. And we have to keep reinforcing that message that this is what we're all about, is trying to find what are the things that will save lives, make people's lives better. And right now, we're challenged.
If there was one thing, and we're almost out of time, but if you can just give us like one word, if there's one thing to change to prepare ourselves for the next big one, what is that?
We need better vaccines, and we can get them. This is not impossible. We can get them.
All right, I appreciate that note of hope to end on. Dr. Michael Osterholm, appreciate it. And Dr. Gandra, always appreciate you as well. The big one, it's on sale right now. Pluses and minuses next. We'll be right back.